Train More Nurses Act 2853 by Juanita Robertson. Nurses are the cornerstone of the healthcare system, representing its largest professional group. They are critical in delivering high-quality care and improving health outcomes for individuals, families, and communities through preventative and curative services. As frontline providers, nurses are vital to ensuring patients receive essential care, boosting healthcare system efficiency, improving patient outcomes, and enhancing the overall resilience of healthcare infrastructures. A robust and well-trained nursing workforce is critical for strengthening healthcare delivery, expanding care access, and achieving national and global health goals. Despite their crucial role, nursing faces a global shortage that impacts care quality, public health, and progress toward universal health coverage. This shortage is driven by an aging population, high nurse retirements, recruitment challenges, difficulties retaining staff, and a need for educators. As well as healthcare demands rises, the strain on already limited workforce worsens. Let's examine the history of nursing education to better understand how and why nursing is so crucial today and why the demand for nursing will always persist. Origins of nursing trace back to the 18th to 1900 centuries, when care was provided mostly by the Catholic Church. As wars started, things began to change. By 1854, Florence Nightingale, called the Lady with the Lamp, regarded as the founder of modern nursing, revolutionized nursing care and education. In 1859, her publication of Notes on Nursing heavily influenced nursing curriculum. By the 1860s, contributions to Nightingale's efforts enabled her to open the first school at the St. Thomas Hospital in London. 1861, Dorothea Dix was appointed Superintendent of Army Nurses, setting rigorous standards for the 3,000 women under her command. These nurses were primarily caregivers for the soldiers during the Civil War on both sides. In 1873, there was a turning point of nursing education where several programs being established that was based on Nightingale's principles that emphasized hygiene and patient comfort, but also included lectures for anatomy and physiology given by doctors. In 1880, nursing education flourished. 35 programs were now established across the United States. In 1888 was the first nursing school for men was at the New York City's Bellevue Hospital. And in 1892, Chicago's Providence Hospital was founded in response to a Black woman being denied entrance to one of the city's leading nursing schools due to her race. In 1896, Alumni Associates were established to help fund and promote higher education for up-and-coming nurses. Here are some nursing school facts for today's nursing. Over 2,600 colleges and universities in the United States offer a nursing program. 1,631 offer certificate or associate degree programs for registered and practical nurses. 1,033 offer a bachelor's degree registered nurse program. 594 offers graduate nursing programs. 614 offers online nursing programs. 254 offers online RN to BSN programs. 149 offer online graduate nursing programs. There are over 900 schools are accredited by the Commission for Education in Nursing, 762 schools accredited by the Commission of Collegiate Nursing Education. With the number of programs in the U.S., why is there a shortage of nursing staff? There is a decrease in admissions to these programs. According to the American Association of College of Nursing, programs like RN to BSN saw a 9.9 decrease in admission. Shortage of nursing staff. The nursing faculty shortage at U.S. colleges is significant in the nation's border nursing workforce crisis. On average, there are 9 registered nurses for every 1,000 people in the U.S., with states like Utah, Georgia, and Texas having the lowest ratios at just 7 RNs per 1,000 people. Insufficient nursing staff contributes to higher rates of medical errors, increased mortality, and more incredibly burnt out and dissatisfaction among nurses. Research highlights persistent gaps in the nursing workforce, stressing the urgent need to address these shortages to meet the healthcare needs of an aging population. Fewer nurses lead to higher patient-to-nurse ratio, increased burnout, and lower care quality, making the healthcare system less efficient. These shortages also hinder progress on health disparities, vulnerable populations, and healthcare costs. To address these challenges, policymakers have introduced initiatives like the Train More Nurses Act to increase the nursing workforce and improve program capacity. The bill proposes more funding for nursing education to create more training opportunities and address the nursing faculty shortage. Factors impacting the shortage. 1. Nursing school enrollment needs to increase more quickly to keep pace with the projected RN and APRN services demand. These trends raise concerns about nursing schools' ability to meet the anticipated demand for nursing services, including the need for more nurse faculty, researchers, and primary care providers. 2. A lack of nursing school faculty is limiting enrollment in nursing programs. The American Association of Colleges for Nursing 2023 through 2024 report found that the U.S. nursing schools turned away 65,766 qualified applications for baccalaureate and graduate programs in 2023 due to faculty shortages, clinical sites, classroom space, preceptors, and budget constraints. A special survey on vacant faculty positions released by the AACN in October 2023 found 1,977 full-time faculty vacancies across 922 nursing schools with baccalaureate and/or graduate programs nationwide. Number 3, a large portion of the nursing workforce is approaching retirement age. 23% of the RNs that work in clinics and outpatient settings have retired or plan to retire in the next 5 years, while the hospital nurses were only about 15.1% going to retire in the next 5 years due to burnout or understaffing concerns. Some project that 1 million nurses will retire by the year 2030. 4. Shifting demographics indicate a growing need for more nurses to care for an aging population. Projected by 2050, 23% of the population will need geriatric care. Number 5, exacerbated by the pandemic, inadequate staffing increases nurses' stress, reduces job satisfaction, and causes many to leave the profession. For nurses contemplating leaving the profession, higher pay was a top factor in deciding to stay, followed by improved work-life balance support and more manageable workloads. Some want to leave due to their experiences during the pandemic as well. Train More Nurses Act. This bill requires the Secretary of Health and Human Services and the Secretary of Labor to conduct a study and issue a report on grant programs to support the nursing workforce to the Committee on Health, Education, Labor, and Pension. The report must include recommendations on how to change the grant programs to 1. Increase nurse faculty in underserved areas, 2. Provide more pathways for experienced nurses to become faculty at schools of nursing, and 3. Support pathways for licensed practical nurses to become registered nurses. The Train More Nurses Act seeks to ensure that healthcare systems are prepared to meet the growing demands of an aging population, particularly the baby boomer generation. By investing in the nursing workforce, the bill addresses the current shortage and provides a sustainable solution for future healthcare needs. It aims to increase the supply of nurses, improve education, and boost retention of qualified professionals. This legislation has the potential to improve patient care significantly, enhance healthcare system efficiency, and help providers meet the evolving needs of patients, ultimately strengthening the healthcare infrastructure and ensuring resilience in the face of future challenges. Based on the study's findings, policymakers could propose new legislation or allocate funding to address the identified gaps in nursing education and workforce development. The Train More Nurses Act, also known as Bill S.2853, was introduced on 19 September 2023 by Senators Jackie Rosen, she's a Democrat from Nevada, which is the primary sponsor, Mike Braun, which is a Republican from Indiana, he's a co-sponsor, and Susan Collins, who is also a Republican from Maine, who is also a co-sponsor. This United States bill was passed in Senate unanimously on 24 January 2024. It was received in the House on the 29th of January 2024 and is now being held at the desk. It has to be passed by this House before it gets presented to the President and becomes a law. This bill has a 53% chance of being enacted, if passed. There are a few supporters and related bills to the Train More Nurses Act. One of the supporters are American Healthcare Association and National Center for Assisted Living. Representative Adam Schiff introduced H.R. 3263, Support Faculty and Expand Access to Nursing School Act, on the 12th of May 2023. This bill requires the Department of Health and Human Services to award grants to nursing schools with shortages of nursing faculty or clinical preceptors for efforts to recruit and retain those positions. H.R. 6122, Train More Nurses Act, is identical to the S2853 introduced by Representative Zachary Nunn, a Republican of Ohio, on 3 November 2023. S2840, Bipartisan Primary Care and Health Workforce Act, introduced by Senator Bernard Adams, an independent from Vermont, on 21 September 2023. A bill to improve access to and the quality of primary care, expand the health workforce, and for other purposes. The plan seeks to allocate over $26 billion to address healthcare workforce shortages, including a $1.2 billion investment in nursing education. What will this bill accomplish if passed? The Secretary of Health and Human Services and the Secretary of Labor jointly shall conduct a review of all grant programs administered by the Department of Health and Human Services or the Department of Labor that support the nursing workforce, and within 1 year of the enactment of this act, submit a report to Congress on the review conducted under paragraph 1, along with recommendations for changes to these grants programs to enhance the achievement of expanding the number of nurse faculty, especially in underserved areas, creating pathways for nurses with over 10 years of clinical experience to transition into faculty roles at nursing schools, and to promote and expand the nursing pipeline, providing pathways for licensed practical nurses to advance to registered nurse roles. So why is the need for it to be passed? As a nurse with over 20 years of experience, I plan to retire in the next decade, God willing, and will eventually need care myself. The growing number of individuals being denied entry into nursing programs for various reasons could impact the availability of care when I or others need it. In conclusion, passing this bill could have a lasting impact on the nursing shortage by increasing funding for nursing education, directly addressing one of the primary reasons for the shortage of trained nurses. By increasing the number of qualified nurses, the bill aims to improve nurse-to-patient ratios, reduce burnout, and enhance patient care and safety. It also supports retaining experienced nurses by promoting better work-life balance, ensuring continuity of care, and maintaining expertise. Furthermore, the bill expands access to nursing education, offering more significant opportunities for a diverse and younger nursing workforce to meet the growing demands of an aging population. It would also help address the nursing faculty shortage by creating pathways for experienced nurses to transition into teaching roles, ensuring a steady supply of well-trained educators. When discussing the four fundamental ideologies that shape the nursing perspective, holism, health orientation, person-centeredness, and caring, new nurses find it increasingly difficult to adopt and embody this perspective fully. This challenge is due to the limited training opportunities and a lack of support from seasoned nurses, many of whom may be nearing retirement or experiencing burnout. This bill is crucial for improving patient care, strengthening the nursing profession, and ensuring that healthcare systems are prepared to meet the future demands.